Started with just give us some Ontario numbers. We've been worried about some of the numbers over the last couple of days. We've had yesterday or the day before was 200 increases with a lot in Ottawa and a lot in certain areas. And, that was a trend for a couple of days. Donc, on était un peu inquiétés au niveau des chiffres ontariens. Il y avait quelques jours qu'on avait des cas augmentants, surtout à Ottawa et Windsor. Mais je suis contente qu'aujourd'hui, les chiffres sont mieux. The stats are better today. Today's numbers show that there's 38,210 cases, which is an increase of 103, which is a much better number, a much more manageable number. And Ottawa Public Health had 14, Toronto Public Health had 24, Windsor has 23 again. Related to farm outbreaks, Peel 15 and York 4. So the numbers are more manageable at this point. Donc, on est rendu à 103 d'augmentation, 14 à Ottawa, Santé à Ottawa. N'oubliez pas qu'Ottawa avait 43 cas dans les quelques jours précédents. Toronto avait 24, Windsor 23, Peel 15 et York 4. Au niveau de notre statistique locale, locally, we've just added one case. We're at 173 now, and that one case was a individual from SDNG. We had added another case, another question on it initially, but that individual was an Ottawa resident. That's why it doesn't appear in our statistics at this point. So this is where we are right now. Donc, on est rendu à 173 cas dans notre région, avec la dernière qui était une personne de SDNG. Toujours aucun changement au niveau d'hospitalisation, au niveau des total de décès. Et aussi, on peut avoir les chiffres ici. So essentially, we have no changes in hospitalizations, no changes in ICU, nobody in the ICU, no changes in our deaths. And so we're continuing to be stable. One of the things that I wanted to point out when I'm looking at our curve, we can see that we've literally, with the exception of the last couple of days here, we've been seeing, cases coming, with a linear trend this way. But we've had the odd case. So if you look, for example, since the middle of July, we've had, multiple cases. So I think it's very important to keep that in mind. Chose que je voudrais revoir, c'est vraiment que, on va le faire en français. Depuis, vous pouvez voir ici, on a toujours des cas, on a un, deux, on en rajoute, et vous pouvez voir depuis comme mi-juin ici, donc on a comme juillet ici qui a commencé. Donc on a eu des cas, on a eu 7-8 cas à peu près dans notre région. Donc moi, je pense que c'est toujours important de voir ces chiffres et de vraiment réagir comme, oui, on est encore dans une pandémie, et à ce moment-là, on devrait faire attention dorénavant, surtout quand on ouvre au stade 3. So that's quite important. Again, it's just a reminder that we're still not out of the woods. We're still seeing cases worldwide. New York, USA, South America, and so on are really a large number of cases that we're seeing. And it's not stopping. So it's important for us to move forward and just continue our trends. Again, focusing on some of the youth, so focusing and ensuring that people are not confused. I know that we've had some issues with, I think some people mixing up the terms, like, the social bubble is 10, but then all of a sudden we're saying you can have gatherings of 50. I think people are misinterpreting that. So that the social bubble of 10 means that it's your household and some friends that can get together on a regular basis and not have to socially distance. The 50 is gatherings of people, and that really pertains to people who are not part of the same social bubble. Yes, there can be gatherings of 50, indoors or 100 outdoors, but there has to be physical distancing. So that's the difference. So if you're going out with your family and going to go to the park or whatever, your family, who's your social bubble, stays with you. The intact. You don't have to have social distancing, but everybody else around you should be. But you could be 50, 100 people. That doesn't matter. So I think people are getting mixed up, and we're seeing a lot of people have parties, 30, 40 people at home saying, well, it's 50 now. Yeah, but you can have gatherings of those numbers, but you need to make sure that you're socially distancing, and we're not appropriate, and we're not. If you're not able to, then you need to be masking. That's very important. J'aimerais souligner que je pense une raison pour laquelle on a vu quelques cas, surtout aux personnes entre 20 et 30, que nous n'avons pas changé le total de leur cercle social. Autrement dit, disons, un foyer avec un autre foyer qui se voit tout le temps, donc ils ont formé le bubble, un cercle social ou un cercle familial. Ces personnes qui sont dans ces 10 peuvent être ensemble sans avoir besoin d'avoir de distance de 2 mètres. Mais on se mêle maintenant parce qu'on dit, oh oui, mais maintenant on pourra avoir 50 personnes ensemble dans l'intérieur et 100 personnes à l'extérieur, aux événements, etc. Mais ça veut dire, par contre, toujours on dit que oui, malgré qu'on pourrait avoir 50 personnes ou 100 personnes à l'extérieur, ces personnes devraient avoir une distance de 2 mètres entre eux autres s'ils ne viennent pas du même foyer ou du même cercle. C'est très important, ça. Donc, je pense que les personnes sont un peu mêlées. Ah oui, 50, très bien, on a 25, pas de problème, on va. Mais ils ne sont pas supposés de ne pas avoir la distance. So I think that's quite important. I had a community update this afternoon, and somebody actually brought up that point that, there's a mix up there and people are confused. So I really want us to understand that as we move forward, that social bubble may change. The people that do not have to distance have to be in that bubble. But if you're with 50 others who are not in your bubble, you got to socially distance, whatever you do. The other thing is that I just wanted to do the testing. We're unbelievably busy in our Castleman office. Our Castleman office yesterday saw 242 cars, which is unbelievable. And so we're up to 22,592 lab testing done in our assessment centers. And at Hawkesbury, we're at 3,697. Cornwall, we're at 5,460. Winchester, we're at 3,915. Castleman, we're at 5,471. Rockland, we're at 2,804. Alexandria, we're at 300. Prescott Russell EMS is 85. And SDNG EMS is 157. Donc, au niveau des tests qu'on fait, on continue à avoir une demande importante à Castleman. Hier, on a fait 240 automobiles. N'oubliez pas qu'à Castleman, c'est un service au volant. Donc, en total, on a fait, depuis qu'on a commencé, on a 7 centres de dépistage, 22 592, avec 3 697 à Hawkesbury. Cornwall avait 5 460. Winchester, 3 915. Castleman, 5 471. Rockland, 2 804. Alexandria, 300. Prescott Russell, paramédic 85. Et SDNG, paramédic 157. One of the other things that I got some emails about before I start answering some of the media questions is that we apparently somebody's calling in and saying that we're giving out exemption cards for masks. We're not giving them. The East Ontario Health Unit will not be giving exemption masks. There's no exemption cards for mask wearing. People who have an exemption just say they have an exemption. Our instructions and directives are that proof is not required. I know that people are printing out these fake exemption cards. I don't know what that is for, but certainly I want to quell the rumor that the East Ontario Health Unit does not and will not be giving out exemption cards. On avait un appel aujourd'hui d'une personne qui a dit qu'il avait attendu que le bureau de santé donne des cartes d'exemption de porter des masques. Ceci n'est pas vrai de tout. J'ai attendu de dire aussi que je vois sur Internet qu'il y a des personnes qui impriment les cartes avec une croix médicale pour dire oh, j'ai une exemption médicale, pas besoin de porter un masque. Mais nous, le directif que nous avons local, c'est que si quelqu'un a une exemption, il s'agit de le dire. On ne demande pas une preuve d'exemption de porter le masque. Donc, I just wanted to make sure that people understood that. We're continuing to get inundated with a lot of calls, particularly about sports and sports. Our sports desk, I call it the sports desk, is getting a lot of calls, 60, 70 calls since we started. We're monitoring the situation. We're now, as of tomorrow, going to be 1 week in stage 3. And we're going to be, that's where we really hope that we can buckle down. Donc, nous, on continue à répondre aux plusieurs appels. On reçoit 2 à 300 appels par jour. Et depuis mars, je pense qu'on est rendu à 21 ou 21 000 appels qu'on a reçus depuis mi-mars. Sont plutôt pour les sports, pour les gymnases, etc. Donc, on a une équipe qui répond à ces questions. Nous avons sur notre site web pas mal de guidance, de guidance compréhensif aussi. On our website, we do have a comprehensive area on activities. I think I showed that last time. I just want to remind people that we do have a very comprehensive listing of return to sports, reopening facilities, and those type of things. That's all I have to say at this point. I got a lot of questions here. I can't answer all of them. The first one here talks about, can the doctor please address the rate of positivity among these tested to date in Canada and whether it can be used to accurately extrapolate an infection rate to an entire population? If about 3.3% of those tested to date in Canada have been positive, does that indicate the same percentage of people who have been infected in general population? Well, two things here. Positivity, the rate of positivity is a measure that we use, and our latest rate of positivity was 0.9%. Now, that doesn't mean that 91.9% of the people are not in the population are not are negative or are negative. It means that from the people you tested, that percentage is there. Now, in Ontario, we haven't tested all the population. I think we're up to 1 million something. We haven't tested everybody. So the utility of the positive testing, the rate of positivity or positivity percentage, is really to assess, in my mind, the rate at which we see the prevalence. It's prevalence essentially. So just to give you an idea, it should be less than 5% is where we want to keep it. We can say, well, it's prevalent, but not to the point where it's not controllable. In Florida, I think it's 22%. When we first started in Ontario, it was like 16, 17%. So we use that as a measure of kind of what's around, not a measure of percentage of people that are immune. On the other hand, I know that somebody else has another question here about blood tests, and we don't have many blood tests in Canada. Today, there was a joint report that was released by Canadian Blood Services and McGill University, I think it was. I just read it literally 15 minutes before I came on, that looked at blood samples taken in May and June from blood donors, and they just screened it for COVID, and found a very low percentage of those people. These are random, people just give blood. Had a very low percentage of people who had positive, signs of previous history of COVID. So they concluded that it's a very small minority of the population. And I'm not sure, I haven't seen the actual results. I just read the press release. But they concluded that, a very small percentage of the population relatively is immune or has had exposure to this virus, and hence a large population is still vulnerable. And yes, I do believe that there is a large population that's vulnerable. Yes, and this question number 3 from the Nation Valley here, are we sitting ducks, those type of things in terms of, yes, I wouldn't call it sitting ducks, but I would say that we have a large percentage of our population that has not been exposed and hence doesn't have antibodies to protect themselves. And that's the role, I think, of the vaccine that hopefully we'll have next year sometime in that situation. Another question here about from Greg in Tribune. We're hearing reports from local businesses that they're concerned about the masking exemptions issues and wondering how they're supposed to enforce masking inside the premises if someone can claim an exemption without having. Well, first of all we want you to do, if you're I want to make it clear, then I got another question about it. The request or direction that we've given employers is to ensure that you have procedures in place that let your staff know that masks have to be worn, that they have to remind people to wear masks, that you have signage and so on, that your staff has to wear the masks. That's what we want. If somebody says they've had if somebody comes in and says and just walks around, and we have proof of that, evidence of that, walking around and nobody tells them anything. At that point, the employer is in default, or should have somebody at least go up to that individual and say, "Excuse me, you should, why aren't you wearing a mask?" Two options. One, the individual, "Oh, I forgot, I'll put it on," or, "I don't have one, give me one," or something like that. Or they might say, "I'm sorry, I have asthma," or whatever. That's fine. It's just that we want them to remind them. And so if that employee says, is given that answer, okay, fine, thank you. Just to make sure, the only thing I will ask that employee to tell that individual is, okay, just make sure you socially distance from others. That's it. I do not expect them to enforce it, to police it. I keep getting the same question all the time. I don't think how I can be clearer that they do not expect the employer to enforce this. All I want them to do is to remind people, and if they get an answer saying, "Well, I can't wear them, I have a medical exemption," fine. And just remind them to social distance. That's all. I don't want them to enforce it. Je vais le dire en français parce que j'ai eu ces questions à plusieurs fois. Il y a beaucoup des commerces qui se demandent comment ils vont enforcer. C'est simple. On demande la suivante. On demande qu'il y a des affiches pour dire qu'il faut porter un masque. On a des affiches qu'on partage sur nos sites web qui donnent les exemptions aussi. Il faut que tout le personnel porte des masques aussi, où c'est approprié, et aussi que le personnel connaît que son responsabilité est d'aller, si quelqu'un ne porte pas de masque, de lui dire, de rappeler que vous devrez porter un masque. Si la personne dit, oh, il y a plusieurs possibilités, la personne peut dire, oh, j'ai oublié, correct, je vais le porter. Ou il peut dire, oh, j'ai de l'asthme ou j'ai des problèmes pulmonaires, je ne peux pas le porter. C'est tout. On ne demande pas plus que ça. On demande l'effet qu'on a donné un rappel pour qu'il puisse porter le masque. Donc, si la personne ne porte pas le masque, ce n'est pas le faux de l'employé. Si, par contre, on a des magasins ou des commerces qu'on voit souvent, les gens rentrent, pas de masque, et personne ne les approche pour dire, je veux dire le personnel, l'employé du magasin, les approche pas, à ce moment-là où il pourrait avoir des amendes. Mais nous, on préfère de faire de l'éducation et de vraiment clarifier le rôle. Le rôle est plutôt de rappeler les gens, d'avoir les procédures en place pour que tous les personnels sachent leur rôle. Le rôle, vraiment, est de rappeler les gens qui devraient le porter, avoir des consignes, avoir les places à laver les mains, etc. On ne demande pas qu'on soit la police. On ne doit pas il ne doit pas l'enforcer. Si quelqu'un ne veut pas le porter, laisse-le. Mais par contre, la seule chose que je demande, juste dire aux personnes, pour une raison ou l'autre, qui ne veut pas porter ou qui ne peut pas le porter, juste faire attention de vous distancer de façon appropriée. So I just wanted to say that in French as well. I think it's very important as well. Let's see other questions we have here. Could the East Ontario Health Unit require doctors and medical health centers to provide their clients with notes to qualify an exemption? One of our readers from Castleman phoned us to tell us to refuse entry at a store, to not wear a mask. Again, I want to stress it again. Again, the stores are misinformed. We're going to have to go out and talk to them again. I sent them I just sent a letter a couple of days ago. It's clear that, and again, if there's an issue, we'll speak to the employer. The employer should not refuse entry, should just remind them. And then if they have an exemption, they do not need a medical note. I want to make that clear. At this point, they do not need a medical note. Regarding the possibility of a second wave, that all health, okay, what would the indications of a second wave period be? Being stage 3, okay, the pandemic recovery plan. Okay, so the question is, what are the plans for a second wave? Essentially, what they are is ensure we have the public health measures in place, in terms of everything from masking now, which we just added, to ensuring people are distancing, to ensuring that people wash their hands, don't go out when they're sick, and so on. Those are things that are foundational in terms of what is required. And then in terms of systemic readiness is several. Having the testing ability, we're testing 20, 30,000 a day, revving that up and maintaining that. That's very important. Perhaps in the future, having a more instant test, which would be great as well, which would help us tremendously. But I think very importantly, aside from a collective approach of quelling the infection, inevitably we're going to get infections. We're going to get little, sort of, little infections, little flames. We're going to put them. We can put them out as long as we're able to put those out. So what I mean by putting those out means that our medical system, can handle it, can handle the number of cases. Our ICUs can handle them. We have enough ventilators. We have enough PPE, and I think we have a lot of stockpile now for those things. Those things are getting better each day as each day goes by. And then the other thing really is, again, looking at the numbers, the testing numbers, rate of positivity, and so on, but also making sure that we have our contact tracing in place. This is very important. This is the role of public health. We will be maintaining, when I say we, I'm talking about public health units across Ontario, for that matter, across Canada, maintaining our ability to be able to, as soon as we get a positive case, contact that individual, ascertain where that individual has been, do all the contact tracing, and then contact each and every individual that person has contacted. And what's getting a bit more complicated now is that with opening up, these people sometimes some of them have 30 contacts. And so we want to be very careful. It could be very time consuming. So we need to have that ready. We're not going to let that go. We're going to have that ready to go. So in combination with our trying to minimize the circulation of the virus in our community, and having the ability to quickly identify, okay, and then contain not only that individual who's infected, but also contain the people who have been contacted, who have direct high-risk contact with that individual. That's what we're doing. That's what we're doing now. So now I think we're in a better position because we have adequate PPE, we have testing, all that stuff is in place, which wasn't in place when we started in March. And additionally, we understand better the dynamics of how this virus spreads. This virus now spreads 2 days before. We know that a couple of days before the symptoms arise. So we understand that better. That's why we want people masked. And that's why when we do our contact tracing, we actually go back a couple of days before symptoms started and contact those individuals as well, which is what we were not doing back in March, April, because we thought that you would only be contagious only when symptoms begin. We also are recognizing more symptoms now. We recognize, like when we started this, when we were looking at people, we're asking them, okay, how did when your symptoms start? They would say, okay, started on Saturday. On Friday, how'd you feel? Well, I was a bit tired, and then some of them started saying, my back hurt me. And then some people, and then we noticed it, we're saying, something, I was fine, but, I lost my sense of smell. I couldn't smell. I couldn't smell things. And then we started seeing that as a pattern. So we added that as a symptom, as a pre-symptom before that. So we're learning more about not only how the virus spreads, the timing of the spread, but also the range of symptoms that the virus can give. So the whole bottom line is quick identification, rapid contact tracing, rapid containment. That's what we're doing, and that's what we're trying to do to offset a second wave. So I got that. Another question is the Upper Canada School Board has a proposal for schools. Yes, we're working with the Upper Canada School Board. We're working with all our school boards. I know that they've got proposals in place. I've worked with the Director of Education personally, and we are also now awaiting some provincial direction. My understanding is that there will be provincial direction for return to school. Again, all this is based on the premise that we're going in the right direction with our numbers, right? And so once we start going back to school, and presuming that the numbers are in the right direction, my suspicion, I think, and I know, and it's been said that this government wants kids, particularly in primary school, to go back to school full-time, 5 days a week with precautions in place. So we're working with our schools with that premise. How are you going to do that? We're working with the schools on how you could do staggered days and so on. Particularly, I believe in the high schools. I think high schools there will be more of a flexibility. So we're working with all the different proposals. We've gone through all of their public health measures. We've gone through them. We have committees that work together with both our English school boards and both health units that share that. So we're quite aware of them. But like I said, I'm just waiting as well from the government to see where they're going to go. Like I said, I suspect that they're going to mandate primary return to school and give a bit of a broader choice of homeschool, online versus staggered school versus alternating day school, perhaps for secondary school as well. So we'll wait and see, but we're working diligently with all of our school boards in that regard. I have another one here from Glengarry News in today's session. I hope he'll comment on the creation, of 5 new health teams, including the Ottawa-based one for Eastern Ontario. Will this help EOHU deal with COVID-19? What are the benefits of such an approach to the community? Well, I was surprised, and as a matter of fact, I'm not sure because the press release said that they named 5, one in West and one Eastern Ottawa / Eastern Champlain. We are Eastern Champlain, like all of us Eastern Champlain, so I'm not sure to what extent. I know that there's other health teams that are being proposed that are closer to the Hawkesbury area, so I'm not sure where that will be. So I'm anxious to see to what that covers. And having said that, at this point, Ontario Health is very new. We've kind of been thrown in to work with Ontario Health in the middle of the COVID, and we're getting to know each other. Whether or not this will help COVID-19, I'm not sure. I'd like to see who's on the team, what the networks are, what the connections are. But certainly, a well coordinated approach would help us in the longer term, particularly as we're getting into the fall months, where we're going to get flu shots are required, when we're also going to be getting a lot of COVID type symptoms, which we're not sure. So I think it's good, but again, I just came today, so I'm not even sure to what extent that'll be, how much of our territory is covered in that, because it starts from East Ottawa. I'm not sure to what extent it goes into how far east it goes into our territory. The other one here is I mentioned on Monday about the fines in businesses. I said that before. If there's a fine, if we see that the businesses are not continually, and this is repeat offenders type of thing, if they're continuing to not remind people or not adhere to our requests to have a policy in place, to have signs in place, then there are fines, and those are under the emergency legislation. They can range from 500 to there's a whole slew of things, and that's how it's going to be done. And those fines can be administered either by police, bylaw, or our offense officers. But like I said, that's not our first thing. And again, it will be the institution rather than the individual customer. There was another one, the Ontario Coalition talked about, this is a question about long-term care facilities, about staff being denied vacation. I have no comment on that one. There was a case, provide a case about, we had a case that we added and we took off because that was actually turned out to be an Ottawa address. And then there was another one about Upper Canada School Board, and I commented on that already. I have to go in about 1 minute, so I'll take maybe another question, but I have a ministry call about 4:45.
Thank you, Dr. Paul. There are no questions in the chat box unless someone on the line does. Good. Thank you, Dr. Paul.
Perfect. On my call. I'm on time for my other call. Thanks, everybody. Merci.